My name is Edmund, and I'll be talking about the mental health of African Americans. So, mental health contributes to our overall health and well being and is known as our emotional, psychological, and social well being. It influences how we think, feel, and act, and this can lead to how we manage stress, relate to others, and make healthy choices. African Americans make up 13.3% of the US population, and approximately 11% of African Americans are not insured compared to 7% for non Hispanic whites. Mental health can impose a threat to African Americans' well being as death rate is higher than whites for heart disease, stroke, cancer, asthma, influenza, and pneumonia since these are closely linked to mental health, and illicit drug use is slightly higher than the national average, sitting at 12.4% compared to 10.2%. And only 1 in 3 African Americans receive mental health care. And this is an issue since mental health can affect our overall well being, and these individuals should have access to help. And African Americans also distrust the healthcare system due to the Tuskegee study, where the healthcare system was not transparent with African Americans. The image shown on the right from 2008 to 2012 shows that African Americans are the third ethnic group to use mental health service.
My name is Caitlin, and I will be presenting on the characteristics of the African American population. Resilience is the first characteristic of the African American population. As resilience is known as a culturally valued trait that helped African Americans overcome slavery and oppression, resilience can influence African Americans in overcoming mental health illnesses by having a positive attitude and wanting to receive treatment. The second trait is spirituality. Spirituality may also provide guidelines for the way people should treat their bodies. As a result, African Americans may be more willing or less willing to receive treatments based on their belief. For example, African Americans who go to a church that has a positive outlook on mental health treatments will influence more African Americans to seek treatments. The third characteristic of the African American population is having families that give each other social support. Social support is important for the African American population as it can help decrease stress associated with stressors and decrease depression symptoms. Therefore, having a supportive family can also influence a person in receiving treatment. The last characteristic is cultural racism. Racism and discrimination both prevent African Americans from becoming healthier as they are associated with depression and anxiety. As a result, racism and discrimination can lead to African Americans losing trust in healthcare providers, which impacts their health outcomes. Now, I'm going to talk about the barriers that can impact African Americans living in the rural South from receiving treatments. The first barrier is lack of insurance. Lack of insurance can cause the cost of mental health treatments to be high, therefore being too expensive to afford. The second barrier is having a lack of knowledge on mental health illnesses. As the symptoms of mental health illnesses is not easily identifiable, it is hard for a person who does not know about mental health illnesses to figure out what is wrong with themselves, their family members, or friends. The third barrier is community stigmas. Community stigmas act as a barrier in the African American community as many do not believe in mental health illnesses. As a result, less African Americans will seek help. The fourth barrier is the health system barriers. One health system barrier that impacts mental health treatment is the primary care department not having good mental health assessments for diagnosis, therefore not allowing African Americans to receive care even if they seek treatments. The fifth barrier is not having available resources such as care or programs. As African Americans who live in the rural South do not have access to many resources, they have less chances to receive treatment. The sixth barrier is having long traveling distance to healthcare facilities. As rural cities are not as developed, many African Americans seeking treatment may need to travel over an hour. As a result, they may struggle to find transportation to the facility, therefore decreasing their chances of receiving care. The last barrier is not having trust in healthcare providers. Due to African Americans experiencing racism and discrimination in their lives, it has caused them to lose trust in their healthcare providers, therefore choosing to not receive unfair treatments.
The Medicaid program pooled claims data from 6 Medicaid programs, which included the states of Arkansas, Colorado, Georgia, Indiana, New Jersey, and Washington. The Medicaid claims data was from the year of 1999. The program focused on disparities between African Americans and Hispanics relative to whites. The population included adults between the ages of 21 and 64 who were continually enrolled in Medicaid. Beneficiaries with mental illness were identified within the data, and the following questions were asked. Is there differential community-based hospital and emergency services used by racial groups with psychiatric disorders? The next question was, are there differences or similarities consistent across Medicaid populations in different states? This allowed racial disparities within mental health care to be identified. There were a total of 82,363 beneficiaries with a mental illness that were identified. The conclusion made was that African Americans compared with whites were paralleled by higher rates of treatment at least one of the remaining settings, ED, inpatient or outpatient hospital, in 5 of the 6 states. Such patterns were not observed among Hispanics compared with.
Hello, I'm Madeline McDougall, and I'm going to be talking about what Medicaid has done well. So the African American population relies heavily on Medicaid for mental health care. We see that the population of African Americans who receive Medicaid benefits is larger than the population of African Americans in the United States. So without this Medicaid funding, a large majority of the population and a large majority of African Americans themselves would be without any insurance coverage and without mental health services had it not been for Medicaid. Additionally, Medicaid is one of the largest beneficiaries of community-based mental health programs in the United States. Medicaid pays for roughly 60% of these community mental health programs, without which a majority of the African American population would receive little to no care. All right, so now we're going to talk about some of the critiques we have of the Medicaid program. Medicaid's population of interest is low-income Americans. And because of the diversity of the American population, especially seen in the low-income individuals, we see a variety of races, ethnicities, and cultures. And Medicaid lacks any sort of cultural tailoring. Currently, the only cultural tailoring that Medicaid provides is through language services and translation services. They don't consider any differences in how different cultures approach mental health care. For instance, we see that a majority of African Americans rely on emergency services and inpatient mental health care, whereas Medicaid focuses its treatment on outpatient services, primary care physician services, and clinics. Some of the reasoning behind this that Medicaid does not take into account is unreliable transportation to these clinics or doctor's offices, being unable to meet the hours of operation due to jobs. So a lot of the low-income African Americans work hours that conflict with these doctor's offices hours. They might be unable to afford time off or unable to be granted this time off. In addition, most of these programs are not created with like CPBR in mind. So the programs are not created by individuals who live in the community, who are aware of these differences and who have like a say in the program creation and the policies made.
Next, I will talk about the recommendations our group has for improving the Medicaid program. These recommendations target the African American population living in the rural South. Through the use of the socio-ecological model, we aim to improve the Medicaid program in increasing cultural competency, increasing educational opportunities, increasing access to more resources, providing more social support, and decreasing stigmas and biases of receiving mental health treatments. Increasing cultural competence allows more African Americans to be treated as they will receive care that is catered to their culture and beliefs. Increasing educational opportunities allows African Americans to attain knowledge on mental health illnesses such as signs and symptoms. African Americans will have more access to resources, which will allow more opportunities to receive mental health treatments as they will have access to a wider range of hospitals and programs. By providing more social support, it will increase the access African Americans will have to professionals, further allowing African Americans to attain better coping skills and reduces stigma. This will increase African Americans' willingness to receive or seek treatment. As a result, reducing barriers of access in the African American population will improve the Medicaid program's ability to improve mental health care within the African American population.
So in conclusion, learning about mental health in African American population has caused us to become more aware about how African American population are impacted not only by their history of slavery and oppression, but also their socio-economic status, social stressors, and psychosocial coping resources for depressive symptoms. As a result, the barriers that they face, such as a lack of insurance, lack of knowledge, community stigma, health system barriers, not having available resources such as care or programs, having long traveling distance to healthcare facilities, and not having trust in healthcare provider can all impact how African American receive care for their mental health illness. Therefore, we hope that more Medicare programs are available to African Americans living in the rural South so that it can help decrease the prevalence of mental health illnesses and help treat African Americans. Thank you.